Alright, this is going to be my first shot at a public YouTube video. It's not really meant for entertainment purposes. Basically, this morning I had no intention of doing a YouTube video, trying to prove anything like that. I'm not trying to here. Just trying to help some folks. I've talked to different people in my life that have expressed differing views on coronavirus, COVID-19, whatever you want to call it. And it ranges from not wanting to go out and completely changing your life because of it, being afraid that if you catch it, you're gonna die because of age, risk factors, just fear. So this morning, today is July 3rd, and we are very removed from the beginning of this thing. I'm gonna try to make this as short as possible, but this morning I just started doing my own research on basically data, and my response to people's reaction to this is it's a risk factor thing. So you have to weigh your risk and what you're willing to do, and I still agree with that. So I'm gonna save the risk factor speech maybe for another video if anybody's interested. But basically, if you see this video you think can help anybody, or if you think I'm dead wrong, you want to send this video to somebody way smarter than me, because, by the way, I'm not an epidemiologist, not a doctor. I don't really have medical training. I was once an EMT. My certification's expired. That gives me no qualifications to talk about COVID-19. But all I'm going to do is go over some resources that are on the internet through easy Google searches that I found today that pretty much surprised me. I think anybody else that sees it will be surprised. And once again, please, if I'm wrong about anything, post it in the comments. I'm going to leave the comments on. Please post it in the comments. And share it with whoever you think it'll help. Share it with whoever you think is smarter than me that can prove me wrong. Whatever. But like I said, this isn't an entertainment video. You just hit play on this thing when you're getting ready for work or something. I don't really care what you do with it, but I think some people need to hear this. So basically all I did, I was hanging out with my toddler, and I compiled some data that's pretty simple that you're not really going to get from the news. So part of the fear stuff comes from our media. So I'm going to start with CNN. Yes, I know they're partisan. We're not getting into that, but it's still a news source that some people get their news from. A lot of people get their news from. So we'll look at some of their current headlines. I haven't really planned this whole video out, but we'll just look at some quick coronavirus updates here. I'll just scan through this. This is how Canada crushed the curve while the U.S. struggles. Pretty sure that has to do with coronavirus. U.S. reports more than 50,000 new coronavirus cases for third straight day. That sounds concerning. Doctor slams Trump for tonight's event. Doctor, okay. Ex-CDC official COVID will attend Trump's Mount Rushmore event. Okay, so Trump's in Mount Rushmore tonight, I guess. That's a big deal for CNN, apparently. So that's just some of the stuff you're going to see. CNN, CBS. Here, what we've got. Here's a controversy, apparently, for this. We got some people in masks for ceremonies. US stays home for July 4th as COVID-19 cases spike. That sounds concerning. Here's some police protest stuff. How to watch. Alright, doesn't look like. Alright, so it looks like CBS. This is CBS News. Non-government experts could pick who gets COVID-19 vaccine first. Huh, interesting. Consumers avoid stores amid COVID surge. So there's some words. COVID surge. Governor issues mandatory mask policy. That's actually interesting. Gym owners, why close fitness centers while bars stay open? Could be the topic of a video in and of itself. Let's see. So we're using words like surge, stuff like that. And of course we gotta talk about Trump going to Mount Rushmore. Anyway, this is NBC. We're talking about school districts push reopen, say there's enough money to do it safely. We're gonna talk about this. Schools. Well, we'll just talk about some facts around school age kids. I'll leave it at that. How to have a safe summer for COVID-19. Maybe I need to make some more videos. Because I have some opinions on that. Alright, here's local. So those three were national news. See what you want about those. But people do get their news from that, and people getting their news from social media. So, let's see, here's local stuff. More on Mount Rushmore. Huge bummer, July 4th will test Americans' discipline. I have a feeling that's COVID related. 2,000 new cases, 951 in hospitals. North Carolina sets coronavirus records. And that's part of why I'm making this video. So I'm not trying to show any kind of preconceived notions. You can probably guess how I fall on this and how this, I'm trying to be any kind of partisan or anything, but how a pandemic turns partisan is beyond me. But anyway, we're not going to touch on any of that this video. Alright, I don't know what this is. Hopscotch Music Festival. Maybe I live under a rock. I don't know if I'm supposed to know what that is. I got canceled though, so that's sad if you like hopscotch music festivals. Let's see. Not much here. This is another local site if you're not in North Carolina. So, anyway, this is ABC. Let's see. Helping seniors during COVID-19. This looks a little more upbeat. So, anyway, not much COVID on ABC 11, actually. So, alright. So, what I did is I basically just started looking at some data. None of this is off any kind of, there's only one that's even off of a site, and this is a local North Carolina, the ABC 11 one I just had up. I don't really favor them. I don't have much of an opinion based on this, but give them credit where credit's due. Anything I refer to in this, I'm going to put links besides those news articles I just pointed to, just for example. It doesn't mean anything, but I'm going to give you links to all this, and it's a YouTube video. Pause it if you think I said something wrong or whatever. But basically, I'm going to pull up all these, and I'm going to leave it in the description. Please look at this for yourself. Look at this for yourself and analyze your own risk based on what it will go over that's compiled by basically the government. So this right here is taken from Center for Disease Control. Got these already pulled up here. This is CDC. I'm gonna leave a link, put them in order. This one right here, this I found pretty astonishing. This is one of the first ones. Well, one I found the other day. We'll go over that one in a minute. This one I found today, I thought it was pretty astonishing. So if we rewind, seems like forever ago when this wasn't in the news. Started hitting the news, I felt like in February. Beginning of March, we started getting into it. And then I believe, if my memory serves me correct, it was around like that last week or couple weeks of March is when we started shutting the country down. From this chart, it looks like he kind of did the right thing. So what I did here, I just looked at, this is the peak of what we were looking at, of the week, our toughest week in the United States for COVID-19 deaths. And this is, once again, this is death counts for COVID, breakdown by age. And this is really important, especially when you talk about school kids and stuff like that. So you can see, if you can't see and you're just listening or whatever, you got 85 and older, hardest hit, and that's going to be a theme. 5,400 and change, 4,400 for 74 to 84, 3,400 and change, 65 to 74. 55 to 64 is 1,900. That still looks like a lot, but you're actually splitting that. You're splitting that 75 to 84 in half. And then it really drops off. 45 to 54, 748. And then here's, to me, where it really gets interesting for working people that are under the age of, say, 50. You're looking at, or I'll say, you're looking at around roughly, I don't know, 1,300, just doing rough math, 1,300 deaths under the age of 50 in the roughest week we had in the United States. I don't want to downgrade any deaths. This was tragic in each one of these people's lives, from the 85 down to the 0 to 24. Don't make this sound like I'm downplaying deaths in any way. This affected people's lives. Deaths affect people's lives. And I feel for every single life that's represented here. However, what I'm trying to point out with this is that in order to make a risk assessment, you need to know the data. The data between, if you're looking at, say, 35 to 44 years old, and this is removing pre-existing conditions and all. 267 people. There's 330 million people. I believe it's 330 million people in the United States. We can check that real quick. Okay, just shy of that. So 328 million people in the United States. So if you're talking about essentially, that's a very small number as a percentage. And once again, I value lives. I understand. I have not personally had anyone in my life die from COVID-19, anything related. I feel for the families. I feel for those people. But it is important we have facts for our own risk assessment. From the very beginning, this has been a risk assessment thing for me. So as you see, we go on, the numbers continue to go down. What's astounding about this is, reading headlines now, you would think, and yes, I understand the concept of, and I don't want to really get into it now, I understand the concept of delayed deaths based on, like, after testing. But right now we're testing more than any time before. So, to give you an example, I have a toddler. I was extremely concerned about this. Both myself and my wife if you don't know anything about me, we both had to keep working. Okay, I'm not going to get any further into it than that. But my child ran a fever. I believe it was early April. We had to go to the doctor. We had to go to the pediatrician. This is small. This is one person sample size. I think they had like 4 tests in the entire pediatric. This entire pediatric doctor, and he said the next day we're going to be testing. We're going to be testing. They're going to be setting up testing for pediatric patients that are going to be staying in the car. That doctor was not concerned at all. He had a fever. And he's fine. Don't know if it was corona or not. He had no other. He ran a fever and had like cold symptoms, so it probably wasn't COVID-19. Don't know. Haven't done anybody tested. Don't know if he's had it. Anyway, he's fine, thankfully. But fast forward to here. My wife didn't run a fever. She had a sore throat. Didn't even run a fever. We're not going to get into symptoms or anything like that, but she had a COVID test before she could go back to work. And the doctor gave her a COVID test, which shows you that the tests are more out there. We're not going to get into testing data and stuff like that, but basically that small sample size shows you that there's a lot more testing going on now than then. That doesn't correlate in this to testing, but we started opening up those states that are being complained about in the news right now. Started opening up back here a little over a month ago. I'd have to look to be sure. I have to make a new video, but we're still trending way downward. So if you look at deaths, say for the week of the 20th right here, you had 2, 0, 24, 10, 25 to 35. So you had less than 100 deaths. Well, you had less than 50 deaths under the age of 44. Once again, there's close to 330 million people in the United States. The worst range was 512, 85 years and older. Once again, I'm not downplaying deaths at all, but we are still talking again about closing down everything. How are we going to open up the schools? Some headlines. So anyway, I don't know what this does. I haven't looked at this. I was just breaking it down. So it's not a chart, or it's not this simple chart, but see this downward slope, and yeah, we shut everything down, but you would think, anyway, seems like we're getting pretty good at treating it. That's what I think. Wouldn't know it from the news. So I don't know what this video is. This next one, let's see, this is a pie chart from the local news. Oops. Pie chart from the local news. Oh geez, don't tell me they took it off. Oh no, this was a great pie chart. Alright, here it is. Alright, this pie chart is going to break it down by age again. In North Carolina, North Carolina is a sample size. If you're not from North Carolina, we don't have any giant cities. Kind of a middle of the road state population wise. But this right here, I think, is a pretty good sample size of what that other chart tried to talk about in a different kind of way. So right here you got percent of cases, and it's kind of what you expect. 25 to 49 years old. I don't know, but it's probably one of the bigger percentages of the population, and they're the ones that are going to be working the most. I mean, most people in the workplace that need to work to pay for whatever they need to pay for. All right. So you would expect, if everything was equal, they would have the most amount of deaths. So number of deaths, there's only 46 of them. So that's the percent of cases was 45 of them. So these were probably symptomatic cases, and this is as of June 10th, because we're not random testing. That's not widespread. And once again, I don't have the data to support that. But we're still not randomly going around and testing people. It's a symptomatic thing, and from what I know about this, a lot of people are coming down with, or asymptomatic with it, when they're doing stuff like testing mothers as they come in the hospitals. They're finding that a lot more people have this, especially at the beginning, than they ever thought. So you have this big thing. It's not quite half, but the percentage of deaths is 4. So let's go over that again. Percent of cases, 45. Percent of death, 4. So this one is going to stick out the most. 75 and up. They had 8% of cases, but 62% of deaths. So that's 658 people died in that age group, and there was only 8% of the cases. So what does that tell you? It tells you by far this is the most deadly group that has the biggest risk for that. And we'll break that down later if you can stand to stick with me. And then we'll look at these. So this one, let's see, 50 to 64, that drops from, you got 21% of the cases, 13, it's still dropping. That's, no spring chicken, 50 to 64, you're still dropping, because this is dominating. But this is just another way to look at the population. So if you look at these two slivers, you don't even see them over here. So this is 0 to 17. The reason you don't see them over here is because you got to get over here. Let's see, this yellow, go 18 to 24 is 11% of cases. They had 2 deaths. That's 0.2% of the deaths. This sliver, 0 to 17, number of deaths was 1. It's tragic. Once again, it's tragic. I'm not downplaying the 1 death. But when you're talking about shutting down schools, keeping kids out of school, this is a child care issue we're talking about. This is the social issue we're talking about. This is children's mental health we're talking about, education, future prospects. No, I'm not trying to push people to recklessly put their kids in school, but you have to look at that. And you have to wonder, okay, what's the risk? All right. And once again, not downplaying it, just want people to be as educated as possible. I didn't know any of this, or most of this, before today. I made assumptions based on where I was getting my news. All right. New York City. So New York City was supposedly the epicenter of COVID-19 in the world, actually, if you believe Chinese data. That's a whole nother video. But, going into conspiracy theories, I'm not really about that anyway, but this right here is an interesting chart that I found. This is death rates COVID-19 in New York City as of July 2nd by age group. So this is going to be per 100,000 people. This is important when you're looking at all this data. Per 100,000 people, when you look at it, go through it, you have to do some math on this. So the citywide total is going to be 220 people per 100,000 people died from COVID-19. So you have to extrapolate the data right here. So basically what I did was take this number and divide it by this number to get a percent population. What I came up with I just looked at the time on this. This is way longer than I thought. I apologize. I'm probably not going to have people hang around this long. But what I found was this is what's going on with the populations. Let's look at the least affected age group. 0 to 17 this is a percentage right here that I calculated. And if I'm wrong, someone please call me out. For goodness sake, call me out. 0.00069%. Once again, every death is tragic. I'll say that again. But you have to take into account, and I'm not going to go over other risk factors for other things, such as the flu and, I don't know, automobile crashes, but we do our own risk assessment every day. You have to look at this. Then find your own age group. Coronavirus has killed 0.021% of the population in New York. You're jumping up here, and this is the order of, you're talking about a big change between this and this population. Yeah, this is a very low number, but this is a percent change in order of magnitude. Exponentially, it's jumping up. So from here to here, it moves over a decimal. Doesn't look like much, but that's kind of a big deal. And then here, doesn't do an entire, decimal move. Here it does. But once again, in the highest category, and this is not taking out any pre-existing conditions, which we'll go over that in a minute, a small sliver of data on that. 1.65% of the population has been removed by COVID-19, has killed off this population, which is way bigger than this one. Okay, yes, it's killing some kids. This is a tiny percent of the population. Okay, you can do your own data of calculating out the rest. This is New York City. This is the epicenter. There's nowhere else I've been to, and I looked at New York City and California specifically because New York City was supposedly the epicenter, especially for the United States, of course, by far. And then I did California because it's another huge state. I think that's our two biggest population states. But this is what I got. So this is shocking to me. These percentages are shocking. Looking at the news, I would have thought this would be a much bigger number. This doesn't look like if I step out of the house, I'm going to die type of numbers. All right. Yes, this is scary over here, but you can mitigate some of that. We're not going to talk about mitigation here. This right here, I tried to copy and paste this. It missed this for some reason, so I'll just go to the website. But I added this in here. California's total population is 39.9 million, so a little more than, it's about 12% of the population. All right, so we'll just pull this chart straight off the website, and this is what I found. Number of cases, you had 4,400 for under the age of 5. That's 1.8% of the cases. They had 0 deaths in California. Supposedly they updated this July 2nd. So think about that. 0 deaths actually for school-age children. 0 to 17 for infants to 17-year-olds. You had 0 deaths. So the percent population out of 16% of the population, I don't know what 16% of whatever their population was, 30 something million. Probably getting a little too detailed in this. Anyway, talk about opening the schools. I think we need to start talking about actual data. And I don't know about your experience with toddlers, or I'm sorry, school-aged kids in general. The local school districts here are talking about forcing people to mask, forcing people to social distance, doing all this kind of stuff that I don't really see school-age children doing for whatever reason. But anyway, I think we should take some of this in consideration, and we could actually, do stuff like talk to families about their conditions. I don't know. Maybe talk about pre-existing conditions for families and if they want to go for this risk. So then you go up to, your highest population, 80 plus. That's how they break this down. The number of deaths is 2,800. The percent of the population is only 3.9% is over 80, but they make up 45% of the deaths. That's astounding. To me, that's a big number. 3.9% of the population is killing 45% of the population. Or 45 makes up 45% of the death. So yeah, this is a big killer, but also these people are going to have the most amount of pre-existing conditions stacked on top of each other, and then you add this disease on top of that. All I'm saying is weigh your risk. Wherever you fall in this, you can weigh your risk. All right. Try to crank through this here. Pre-existing conditions I talk about here. I went to this one. So this chart, let's see. This chart talks about pre-existing conditions right here, and it lists the known pre-existing conditions right here. So all the way from diabetes to chronic lung disease, chronic renal disease, pregnancy is actually one they've discovered, chronic liver disease, former smoker, current smoker, and what I focus on was this, the ICU admissions, because it's the most serious, obviously, because all you have over here is the hospitalized. I don't want to be hospitalized from COVID-19. I don't want to get sick. I don't really want to catch it. But I'd rather be hospitalized than put in an ICU bed. These are the most serious cases. I broke these down here. And I could be wrong how I break this down. So ICU cases for non-pre-existing conditions. This is a very limited set of data. I wish I could find a bigger set of data. This is only February 12th through March 28th. So this is basically from, it was barely making the news to the peak of it. And then it just stopped for whatever reason. I wish we had more data. Anyway, I broke this stuff out. Cases known with non-pre-existing conditions, 99. Cases listed for pre-existing conditions, and this is where I couldn't quite get the chart, but it's more than one pre-existing condition included on top of those one pre-existing condition. And I forgot to do the math for this one, but it's basically you got a 10 times more likely shot of ending up in an ICU bed. So, what you could potentially end up doing, and this could be bad math, but you could end up possibly moving these decimals over again for people with no pre-existing conditions, because it's an order of 10 times that. But I didn't finish the math on this. So one or more conditions, I'm not sure. And it looks like, they put, this is, So this is part of this. So anyway, I believe I was right on this. You have a 10 times more likelihood of ending up in an ICU bed on this initial data that they gathered. And once again, early data is, not exactly accurate, but you have the potential to push this back another decimal if you don't have a pre-existing condition. That you have a 10 times more likelihood chance of ending up in an ICU bed, depending on that pre-existing condition. So, but this is what it is with and without added in there. You got a pre-existing condition. All I'm saying, weigh your options. And instead of just staring at the news, I'm not saying don't watch the news, instead of staring at the news, them telling you they were breaking records for testing, guess what we're doing more of now than we haven't done before is testing. Or positive, that they're getting more positive tests than ever. We're doing more tests than ever. So that could be a correlation. Anyway, do your own research. I'm going to list these sources so you can start doing your own research. I encourage everybody to do it. I did it in about 30 minutes. And this video is taking way too long. Please post questions in the comment section. Please share it to anybody who you think it could be helpful, or anybody that could show how wrong I am. I would love for them to make this more accurate. And if it is totally dead wrong, I'll take the video down. And maybe I'll make another video of that's more accurate. Anyway, hope you stay well, educate yourself. Don't be scared off by the news.